Hello, this is my second presentation on chlorambucil for a non-specialist audience, namely a high school class who has no understanding of organic chemistry, structures, function. They might know how DNA works. Great, okay. So chlorambucil, an alkylating agent. Chlorambucil is an anti-cancer drug approved for use in 1957. It's a nitrogen mustard, so a mustard chemical. What do you think? You think mustard gas, right? This is very similar. It's a very similar structure. You just replace one atom to make it less reactive. You replace sulfur with a nitrogen. It becomes less reactive and is actually useful for the treatment of cancer as a part of chemotherapy. Chlorambucil was developed after chlormethine, which was developed in 1948. And chlorambucil used to be used as an immunosuppressant and is considered an alkylating agent. But what is an alkylating agent? How does it work? So, with a lot of drugs and drug targets, you have the drug and the target. And the dynamic between the two is often that the drug is going to attack something about the target, either to keep something else from hitting the target, to stop whatever target's doing, but for whatever reason, usually the drug attacks the target. Now, with alkylating agents, it's a bit different. And so that's why this is an interesting class of anti-cancer drugs. Alkylating agents are actually attacked, they entice whatever their target is to attack them. And don't get me wrong, they all end up bonded in the end. But it's a very different method of if you have something that you know is going to react, you inject something that you know it's going to want to react with. And so that's kind of how alkylating agents work. So how does chlorambucil work? It's taken orally once a day, and it absorbs very quickly. The area around cancerous tissues are similar to some of the conditions that chlorambucil has, and opposites attract. So it does encourage the absorption of the chlorambucil into cells. And it binds to two bases of DNA. And how it does this is it actually starts as a molecule that wants to attack something, but it attacks itself in a manner that makes it enticing for something else to attack it, the DNA bases. And just to review, DNA is going to be made of two strands, each with bases on them. As you can see, there's two strands here, and these little bits are the bases, and they all line up with an appropriate base pair. And so when DNA splits, it's able to entirely replicate the other side based off of the pairs that are here. And so what happens is that chlorambucil, as an alkylating agent, has two areas where it's able to be attacked. And it's attacked usually by a guanine base, which is a base on DNA. It's over in the green. It attaches itself to the DNA in more than one location, causing a cross link. And this link does not allow for that same kind of replication of matching up the bases. And so it does not enable the creation of new DNA strands. So yes, it stops the replication of DNA in mutated cells. And it can damage DNA in all phases of the cell cycle. It's not selective to the phase. And then the drug is metabolized in the liver. Old versus new. So chlorambucil comes from chlormethine. Chlormethine it's either injected or it has a topical use, but it's a skin irritant. It has harsher side effects, and absorption of the topical gel into the internal organs is actually concerned by researchers now. And if you look over to the left, you'll see the structure for chlormethine above and the structure for chlorambucil below. And what I want to note is that they really don't look that different. And so what chlorambucil is a better tolerated version of chlormethine that does the same thing. And these areas right here are what end up leaving and bonding to the DNA. Chlorambucil is orally administered, which is not possible for chlormethine because of its irritability, but both medications still have the side effects commonly associated with other alkylating agents, other ones of the same class, drugs that like to be attacked themselves. So what are the risks involved? Since chlorambucil is an alkylating agent, it can damage DNA and potentially affect the cells in bone marrow, which are responsible for making new blood cells. And this creates a risk of leukemia, but only at high doses and over long periods of time. And this is the reason why chlorambucil is only used as an anti-cancer drug now instead of an anti-inflammatory, which it used to be. Because if you have chronic pain for some condition and you've been taking chlorambucil for 5 years, it's not worth getting cancer from unless you're treating cancer. Associated with the risks of other alkylating agents, vomiting, diarrhea, alopecia, including hypersensitivity, rash, and sometimes issues with the liver. And then common effects associated with long-term use are cancer. So how does chlorambucil differ from other anti-cancer drug classes? As an alkylating agent, as stated, it binds itself to DNA in two locations, preventing replication of that DNA strand. Other types of cancer drugs include antimetabolites, which replicate the very building blocks of the DNA, which block bonding, and so therefore blocking DNA replication. Anti-tumor antibiotics, not an antibiotic in a classic sense, in which we think, oh, getting rid of an infection, but more it changes the way the DNA is inside of the cancer cells themselves to keep them from multiplying. Topoisomerase inhibitors inhibit an enzyme called topoisomerase, and what this enzyme does is it separates the two layers of DNA, allowing for each to replicate and to be joined by their base pairs. And inhibiting this enzyme stops this replication. And mitotic inhibitors are derived from natural products, and they stop cell division by inhibiting enzymes which produce proteins needed for cell reproduction. And corticosteroids are hormone treatments that often just help alleviate a lot of the symptoms that come with chemotherapy. There are other treatments that go along with these, which are targeted therapies, including hormone therapy like corticosteroids and immunotherapy. And that is my presentation. Thank you so much.